The registered nurse first assistant is a perioperative registered nurse who functions in an expanded role. The RNFA is involved in the management of the patient throughout the entire perioperative period. The RNFA role is recognized within the scope of nursing practice by the State Nurse Practice Acts in all 50 states. The RNFA is a perioperative registered nurse who works in collaboration with the surgeon and other healthcare team members to achieve optimal patient outcomes, has acquired the necessary knowledge, judgment, and skills specific to the expanded role of RNFA clinical practice, interoperably practices at the direction of the surgeon, and does not concurrently function as a scrub person. What is it that an RNFA can do? Well, each state has their own specific guidelines that maps out exactly what they can do. These are the following for the state of California. They can assist with the positioning, prepping, and draping of the patient or perform these independently, if so directed by the surgeon. Provide retraction by closely observing the operative field at all times. Also, by demonstrating stamina for sustained retraction and retaining manually controlled retractors in the position set by the surgeon with regard to surrounding tissue. Also, provide retraction by managing all instruments in the operative field to prevent obstruction of the surgeon's view, and anticipating retraction needs with knowledge of the surgeon's preferences in anatomical structures. Provide hemostasis by applying electrocautery tip to clamps or vessels in a safe and knowledgeable manner as directed by the surgeon, or by sponging and utilizing pressure as necessary. Also by utilizing suctioning techniques. Applying clamps on superficial vessels and the tying off electrocoagulation of them as directed by the surgeon. Another way an RNFA can provide hemostasis is by placing suture ligatures in the muscle, subcutaneous, and skin layers. And finally, by placing hemoclips on bleeders as directed by the surgeon. RNFAs can perform knot tying by having knowledge of the basic techniques, tying knots firmly to avoid slipping, and avoiding undue friction to prevent fraying of suture. Carrying knot down to the tissue with the tip of the index finger and laying the strands flat, approximating tissue rather than pulling tightly to prevent tissue necrosis. They can also provide closure of layers by correctly approximating the layers under the direction of the surgeon, demonstrating a knowledge of different types of closure, and correctly approximating skin edges when utilizing skin staples. RNFAs also assist the surgeon at the completion of the procedure by affixing and stabilizing all drains, cleaning the wound and applying the dressing, as well as assisting with applying casts and splints. Just a recap of all the things that RNFA can do in California are assist with the positioning, prepping, and draping of the patient, provide retraction, hemostasis, perform knot tying, provide closure of layers, and assist the surgeon at the completion of the procedure. So what does it take to become an RNFA? First, you must hold the RN license, and you must have earned the National Certificate in Perioperative Nursing and complete a Nurse First Assistant educational program approved by the Association of Perioperative Registered Nurses. In addition to course prerequisites include 2 years experience in the operating room, basic cardiovascular life support, advanced cardiovascular life support certification, letters of reference from colleagues and surgeons, professional liability insurance, and credentialing at the hospitals where the RNFA wishes to practice.
That's all, folks.